Snake bites are one of those emergencies where most people think they know what to do. Maybe it's something they saw in a movie or an old piece of advice passed down over the years. But when it comes to treating snake bites, some of the most popular beliefs are not only wrong, they can be dangerous. Here's just one example of why you should watch this video. Did you know that you should treat snake bites differently depending on the region of the world you live in? If you didn't know that, then you should keep watching. And my recent daily quiz question proved that most people do not know what to do in case of snakebite, since only 24% of you got the right answer. One of the most common myths is the idea that you should suck the venom out. Whether it's using your mouth or a store-bought suction device, this method is still widely believed. The reality is, suction removes very little venom. What it can do is damage the tissue, introduce bacteria, or give a false sense of security that delays real treatment. Using your mouth especially adds the risk of infection and exposure to venom in a second person. Now, if a suction device is all you have, then use it. It's kind of like using a t-shirt as a bandage. It's not ideal, but in the absence of proper supplies, it's better than doing nothing. Another popular but harmful myth is that you should cut the wound open to let the venom drain. Ouch. This advice was once part of our old first aid manuals, but it has since been thoroughly debunked. Cutting into the skin adds trauma, increases the chances of infection, and does not remove the venom. It only makes the situation worse. A third myth is about tying a tourniquet above the bite. The idea is to trap the venom and stop it from spreading. But what actually happens is that you cut off circulation entirely, which can lead to severe tissue damage, nerve death, or even amputation. Most snake venom causes swelling, and if the area is tied off, it can increase pressure and damage well beyond the bite itself. There's also a common belief that you'll know right away whether a bite is serious. The truth is, some venomous bites, especially from coral snakes or young snakes, can be painless at first. Just because it doesn't hurt immediately doesn't mean it's not dangerous. On the flip side, some non-venomous bites can bleed, bruise, and swell, which leads people to panic thinking it's venomous when it's not. So what should you actually do? First, assume every snake bite is venomous unless you're absolutely certain it's not. If you didn't see the snake or couldn't clearly identify it, treat it as if it were venomous. Time is critical in a venomous bite, and waiting to see symptoms could cost you valuable minutes. Second, stay calm. This is one of the most important and most difficult things to do. Fear and panic increase your heart rate, and the faster your heart beats, the faster that venom can spread through your system. Focus on breathing slowly and keeping your movements minimal. Keep the bite site below the level of your heart. A lot of people instinctively raise the injured limb to reduce swelling, but that can actually speed up the venom's movement. Keeping the limb below the heart slows circulation and gives your body, and any help on the way, more time. If you're with someone, don't let them walk or run. Movement spreads venom. If you're alone, move very slowly and deliberately. Get help as quickly as you can without exerting yourself. If you're in a remote location, this may mean signaling for help or calling emergency services if you have any kind of signal. Now let's talk about non-venomous bites. These don't involve venom, but that doesn't mean they're harmless. Snake mouths are filled with bacteria, and even a minor bite can lead to infection, especially if it's not cleaned properly. Some people also have allergic reactions to the bite itself or the bacteria that's been introduced by it. Signs of a non-venomous bite include small puncture marks without the intense swelling or spreading discoloration. Still, it's smart to wash the wound thoroughly with clean water, apply an antiseptic, and monitor for signs of infection like redness, heat, or pus. In some cases, antibiotics actually may be needed. There's also the myth that baby snakes are more dangerous than adults. This one's debated. The idea that young snakes can't control how much venom they inject, so they release all of it. And that may be partly true, but the overall amount of venom a small snake carries is far less than what a large adult can deliver. And either way, if you're bitten by a venomous snake, baby or adult, seek medical attention immediately. Don't assume one is less dangerous than the other. Another major factor that often gets overlooked is location. Snakebite treatment is not the same around the world. Most venomous snakes throughout North, Central, and South America are pit vipers with hemotoxic venom, meaning the bite usually affects tissue and blood vessels near the site and spreads more slowly than neurotoxic venom. The venom causes pain, swelling, bruising, and tissue death near the bite site. Because of this, the damage tends to stay localized for longer, especially in the early stages. That's why in the U.S., treatments that support the body locally, like plantain poultices or activated charcoal paste, might offer some benefit in rural or off-grid settings. They don't remove the venom, but they may help reduce surface-level swelling and inflammation while you wait for help, or keep you alive if help isn't coming at all. In contrast, Australia and parts of Asia are home to snakes with neurotoxic venom, which attacks the nervous system and spreads rapidly through the lymphatic system. These bites often don't show major swelling or bruising at the site, but they can affect breathing, muscle control, and nerve function very quickly. In those cases, the recommended first aid is pressure immobilization, firmly wrapping the limb, but not as tight as a tourniquet, and keeping it completely still to slow the spread of venom. Topical poultices or suction devices don't help and can even waste valuable time. It's a completely different approach from what's used in the U.S., and it's one reason why knowing where you are and what kind of snakes live there matters so much. If you spend a lot of time outdoors or live in a remote area, it also makes sense to have a few herbal allies on hand. Not necessarily as a replacement for anti-venom, of course, but as a support. One of the best herbs to keep nearby is echinacea. Most people think of it for colds, but it also stimulates the immune system, helps fight infection, and reduces inflammation. In the case of a snake bite, it can be taken internally to support the body's natural defenses. And if you have nothing else on hand, it can be applied topically to help calm the area and act as a mild antiseptic. Again, it won't neutralize the venom, but in a survival situation, anything that supports the body while you seek help is worth knowing about. A plantain poultice made by crushing the fresh leaves into a paste and applying it directly to the bite may help draw out some of the surface toxins and reduce localized swelling while you're waiting for help. Bentonite clay, if available, can also be mixed with a little clean water to form a paste and applied topically. It is known for its ability to bind to toxins and soothe inflamed skin. In the end, the best way to survive a snake bite is by knowing how to respond quickly and correctly, not relying on myths or outdated methods. Don't cut the wound. Don't suck the venom. Don't use a tourniquet. Stay calm, keep the bite below the heart, and seek help immediately. Treat every bite seriously until you know otherwise. And if you're off-grid or hours from help, support your body in every way you can, with herbs, with clean bandaging, with calm thinking, and get moving towards treatment.